So we're going to call this the invisible epidemic, because substance use amongst the elderly is not only a reality today, it is a growing reality. It's a growing population. There are more older people today than we've had in the past. People have opportunities to live longer, and people are in situations where they're living longer. So seniors are especially vulnerable because of the unique challenges that they're facing from the natural growing process, the aging process. So, and they're naturally what is normal in aging. But you do see a lot more people who are moving into nursing homes, more people who are medicated, and this population's health needs, they continue to be ignored in the sense that they may be given pain medications, or maybe things that are going on that are not being checked properly. People around them who are working with them have maybe not been trained properly. And so that creates a higher risk for alcohol and drug abuse and serious use. And obviously we go from, misuse of substances to severe use, mild, moderate, severe. So many of our people who are elderly are falling into the severe category because of a lack of education, some other things that we'll see today. Another need that we have for today is to incorporate age-sensitive and age-specific treatment practices. So an assessment that works for a 25-year-old may not be a good assessment for a 70-year-old. So we're going to look at some of the differences in that. Our older population is culturally, racially, and ethnically diverse. So as our country is more diversified, so is our elderly population. So we need to recognize and address diversity in that sense. Collaboration among service providers. And so it's very important that we learn to look at the bigger picture with our people, in the sense that, we need to be able to communicate between departments and communicate between different areas that may be dealing with them, especially those who have co-occurring medical issues. We find that some older clients are getting medications from several doctors. There may be some issues with those not working well together, and that in our hiring and our training and retaining staff, we need to really build into people who are motivated, who are committed to helping the elderly population, but that they're able to be aware of and educated to look at some of the issues and signs and symptoms, and to be aware of issues in the treatment process. And so, you have this older guy, and he might have a number of different doctors and several different people who are working with him. But if they're not coordinating together, and if they're not aware of substance issues, then he may easily become addicted. So let's talk about an example of abuse. If you want to put into the chat there, please, what is an example of substance abuse in the area that you're working, whether it's you might be in a healthcare program, treatment center, elderly home, whatever it might be. Share an example with the group of someone that has had a substance use issue with that elderly population. So if you put that in the chat, it usually has to do with the individual's motivations. What is their intention? What are they, what's driving them? Pain medication, or we're taking prescribed medications, benzodiazepine, private practice in alcohol in the elderly. So for example, let's say a person knows that they'll get a good feeling from a medication. Well, it makes sense to them, if they'll take more, they'll feel better. And so this becomes an example of substance use disorder, a lot of pain medications, that's right. Medical issues brought on by substance abuse, sure. And so what happens is then the person will continue to look for that euphoric feeling. Now that's true with anyone and substance use issues, no matter what their age is. But I believe it'll be exacerbated with the elderly, in the sense that, we'll look at some of the factors, but when they feel good and want to feel better, then it creates a problem of substance use. So we have a number of things going on in the chat: alcohol and pain, vaping, THC, and alcohol. These are all very current issues in private practice: pain meds, alcohol, depression, anxiety. So this is a real problem, and it's good to know that most of us in our group today are facing these. The most important questions we want to ask And what I want us to try to think about is to really simplify things as we're dealing with the elderly population. So some of the most important questions that we need to ask, the first one would be this: does your use of this substance cause harm? We don't want to be confrontational. As people age, they tend to be more set in their ways, generally speaking. So if we come in, talking in a confrontational way, obviously they're going to defend themselves and push back. But is your use causing harm? Now they may say, no, not really. Then our job on that is going to be to help them see the harm that is causing. Well, your doctor says that this is going on. You're having problems with that. You fell down, because you were drinking too much. So we want to carefully and gingerly cite to them circumstances that have become problematic because of their substance use. The second question that's very important that we want to address with our clients is, how does this affect your quality of life? Now, some elderly people are living with chronic pain. That pain's not going away. And so what happens is, when they're on a pain medication that works for them, their quality of life may improve. But what we all know historically, and fortunately now are more aware of, those very pain medications develop a high tolerance and eventually are not working at all. And so when we have people that have true legitimate pain, then that pain management needs to be done by a healthcare professional so that it can be done properly. But what is their quality of life? And so they may have to look at different avenues of their life in a big picture to say, well, I have pain medications, but the pain medications are causing more problems than the original pain that I suffer. That can happen at times. And the denial, someone said denial is even greater than it is in younger people. How true that is, because there's a defense there that I need this medication, and it's allowed, it's not illegal, and so they will have even more denial about it. Very, very true.